A man came into my clinic one rainy afternoon. Don Roberto, 64 years old, 6 months of on and off pelvic discomfort, waking twice every night to urinate, sometimes a burning sensation at the end of the stream, and a constant low-level ache between his scrotum and anus. He told me he'd already tried antibiotics a couple of times and felt better for a few weeks. Then the pain came back. He was tired of pills and scared of becoming dependent on medication. That's when he leaned forward and asked, "Doctor, if my prostate is inflamed, shouldn't I just stop taking medication and try something natural instead?" The title of this video grabbed your attention for that reason. If you have an inflamed prostate, don't take medication, do this instead. But before anything else, let me be crystal clear. If you have fever, severe pain, or cannot urinate, seek emergency care. Now, the nuance you need: don't automatically take medication, and don't self-medicate or stop a drug your doctor prescribed without discussing it first. For many men, especially those with a bacterial infection, medication is essential. For others, particularly men with chronic non-bacterial inflammation or symptoms related to pelvic floor dysfunction or benign enlargement, a structured plan of non-prescription measures, lifestyle changes, and supportive therapies can relieve symptoms and often reduce the need for long-term meds. I want to show you a safe, prioritized action plan you can start today while you arrange proper evaluation. If you're experiencing these symptoms right now, pause this video and call your doctor or use the link in the description to find urgent urology contact or a printable symptom checklist. First, what do we mean when we say inflamed prostate? The word prostatitis can cover several different conditions. Acute bacterial prostatitis is a sudden, often severe infection, high fever, chills, very painful urination. This is an emergency and needs antibiotics right away. Chronic bacterial prostatitis is a recurring bacterial infection that lingers despite treatment. Chronic pelvic pain syndrome, sometimes called chronic non-bacterial prostatitis or inflammatory prostatitis, is where inflammation or pelvic floor issues cause ongoing discomfort without a clear bacterial culprit. And then there's benign prostatic hyperplasia, or BPH, which is age-related prostate enlargement that can cause urinary frequency, a weak stream, incomplete emptying, and nocturia. But it's a different process from infection. Knowing which of these you're facing changes everything about treatment. What symptoms should make you sit up and call someone now? A high fever or chills, the sudden inability to pass urine, or severe escalating pelvic or abdominal pain. These are red flags. But there are also less dramatic signs that should prompt an evaluation. Burning when you urinate, needing to go urgently, going frequently, especially at night, a weak or interrupted stream, feeling like the bladder never empties, pain in the perineum or lower back, and sexual dysfunction or pain with ejaculation. If any of these sound familiar, don't ignore them. They need assessment. How do these problems arise? Causes vary. Bacterial prostatitis is usually due to common urinary tract bacteria. Think E. coli traveling up from the urethra. Risk factors include recent urinary procedures, bladder outlet obstruction, or episodes of urinary retention. Non-bacterial inflammation often involves a combination of pelvic floor muscle dysfunction, chronic inflammation, nervous system sensitization, stress, and sometimes prior infections that leave the area more reactive. Lifestyle contributors matter. Prolonged sitting, dehydration, heavy alcohol or caffeine intake, spicy foods, and low levels of physical activity can all aggravate symptoms. Sexual habits and certain medical conditions like diabetes also change your risk profile. Diagnosis starts with basics: a careful history and physical exam. A urine dipstick and microscopy can identify infection. Urine culture helps determine which bacteria are present and what antibiotics will work. In some cases, specialized testing of prostate secretions or repeated urine tests is used. Imaging, like ultrasound, may be ordered if there are concerns about retention, stones, or structural problems. The key point is this: differentiating bacterial disease from non-bacterial inflammation or simple enlargement is essential because it dictates whether antibiotics are necessary. That's why I keep repeating, don't self-diagnose, get tested. So what does treatment look like? Let's split it into two clear paths: when medication is essential and when non-pharmacologic measures should be central. If infection is identified, especially acute bacterial prostatitis, antibiotics that penetrate the prostate are necessary. These medicines typically start to relieve symptoms within 24 to 72 hours, but a full course is often longer, and your doctor will decide the appropriate duration based on the infection type. Alongside antibiotics, short-term anti-inflammatory medications like NSAIDs can reduce pain and fever, and alpha blockers can help ease urinary flow by relaxing the bladder neck and prostate muscle, improving symptoms over days. Important rules here: follow your doctor's prescription, don't stop antibiotics early just because symptoms improve, and check with your clinician before adding other medicines. Never stop a prescribed medication without medical advice. But if no bacteria are found and your problem is chronic pelvic pain or non-bacterial prostatitis, then medication is not always the first or only answer. For many men, the first-line approach is non-pharmacologic and focuses on symptom relief and retraining the pelvic floor. Warm sitz baths, sitting in shallow, warm water for 15 to 20 minutes several times a day, are a remarkably effective, low-risk way to reduce pelvic muscle tension and improve comfort. Pelvic floor physical therapy with a trained physiotherapist can identify tight or overactive muscles and teach relaxation techniques, manual therapies, and exercises that often change the pain pattern. Simple behavior adjustments help too. Avoid long periods of sitting, take standing breaks every 30 to 45 minutes, change your bicycle seat or avoid prolonged cycling, and try scheduled, gentle ejaculation that some men find reduces congestion. Hydration matters. Drink enough water to avoid concentrated urine that irritates the bladder. Reduce bladder irritants, alcohol, caffeine, carbonated drinks, spicy or acidic foods, at least while symptoms are active. Over-the-counter NSAIDs can be used short-term for pain if you have no contraindications, but discuss this with your primary care provider if you have kidney disease, stomach ulcers, or are taking blood thinners. Mind-body strategies, stress reduction, breathing exercises, and sometimes cognitive behavioral approaches can substantially reduce symptom severity over time because chronic pelvic pain often has a strong nervous system and stress component. Supplements and certain foods can be helpful adjuncts, but let's set expectations. Evidence is mixed, benefits are often modest, and you should view them as part of a broader plan, not as miracle cures. Nettle root is one supplement with some supportive data. Studies frequently used root extracts rather than leaf, and typical doses reported range from about 300 to 600 milligrams per day. Saw palmetto extract has been studied extensively for urinary symptoms from BPH. The commonly used standardized dose in trials is roughly 320 milligrams per day, but evidence is mixed, and benefits may take 2 to 3 months to appear. Lycopene, the antioxidant in cooked tomatoes and tomato sauce, has some modest association with prostate health, and including cooked tomato products in your diet is reasonable. Pumpkin seeds, which contain zinc and other nutrients, can be a healthful snack and may support prostate comfort. Omega-3 fatty acids from fatty fish and plant sources, turmeric, curcumin, and green tea provide anti-inflammatory and antioxidant effects that could be beneficial as part of an overall anti-inflammatory diet. If you try supplements, give them time. Many need several weeks to months to show an effect, and always consult your physician because supplements can interact with prescription medications or affect lab tests. Here's a practical timeline you can expect. Anti-inflammatories often relieve pain within hours to a day. Alpha blockers can improve urinary symptoms within days to a few weeks.
Antibiotics for bacterial infections usually begin to reduce fever and acute pain within 24 to 72 hours, but the full course may last weeks. Supplements and dietary changes generally require at least 6 to 12 weeks to evaluate benefit. Keep realistic expectations. Lifestyle and supplements aim to reduce symptom burden and improve quality of life, not to guarantee a cure overnight. Now, what can you do today, immediately, while you're arranging evaluation? Start with a set of safe, prioritized actions. Drink adequate fluids throughout the day. Aim to avoid very concentrated urine, but don't overhydrate to the point of discomfort. Take warm sitz baths 15 to 20 minutes, 2 to 3 times daily as tolerated. Avoid or reduce known bladder irritants. Cut back on alcohol, caffeine, carbonated beverages, and spicy or acidic foods. Break up long sitting periods. Stand and walk for a few minutes every half hour. Use a heating pad over the perineum for comfort if that helps. If you have no contraindications, a short course of OTC NSAIDs can reduce pain and inflammation, but check with your doctor first if you have ulcers, kidney disease, or are on blood thinners. Start a log of symptoms. Note timing, triggers, and what helps. This is valuable information for your clinician. And very importantly, don't automatically take another course of antibiotics without evaluation. If you were prescribed them before and symptoms recurred, those earlier choices may no longer be appropriate. Seek testing so treatment can be targeted. Here's something most men don't know about chronic prostatitis. Pelvic floor muscle dysfunction is a leading contributor, and it's treatable. Many men respond well to pelvic floor physiotherapy that includes biofeedback, manual release, and learned relaxation. If you've tried repeated antibiotics without lasting benefit, ask your urologist about referral to a pelvic floor specialist. Behavioral therapies and pain management strategies can also make a large difference when pain becomes chronic. Let's also be realistic about when medication or even surgery becomes necessary. Acute bacterial infections require antibiotics. If you develop urinary retention, the inability to pass urine, you may need catheterization and urgent treatment. Recurrent, culture-proven bacterial prostatitis frequently requires targeted antibiotic therapy that may be longer in duration. Surgery is reserved for specific complications, persistent obstruction causing kidney problems, stones, or repeated retention despite other measures. Removal of obstructive tissue may be considered for men with severe BPH that does not respond to medical therapy. But most men with chronic pelvic pain or mild BPH do not need surgery. Surgery decisions are individualized and usually follow a careful trial of medical and conservative measures. You asked how to prevent flare-ups and manage this long-term. Regular physical activity, pelvic floor exercises or therapy when needed, maintaining good hydration, limiting bladder irritants, managing constipation, and reducing prolonged sitting are practical habits with real benefits. Routine checkups with your primary care physician and periodic urology reviews for persistent or worsening symptoms help catch issues early. If you have comorbid conditions like diabetes, controlling blood sugar lowers your risk of urinary infections. I want to touch briefly on supplements again with realistic guardrails. Nettle root, some studies use 300 to 600 milligrams per day of standardized root extract, but products vary. Check labels and consult your physician, especially if you take blood pressure medications or anticoagulants. Saw palmetto, typically used as a 320 milligrams per day standardized extract in trials, but the effect size is modest and results are mixed. Give it at least 8 to 12 weeks to judge benefit. Lycopene, incorporate cooked tomato products rather than raw, since cooking increases lycopene bioavailability. Pumpkin seeds and foods rich in zinc and magnesium can be supportive. Omega-3 fats from fish oil may reduce inflammation systemically. Turmeric and green tea have antioxidant properties. For curcumin, look for formulations designed to improve absorption if you decide to try them. And always, consult your physician before combining supplements, especially if you are on prescribed medications, have chronic illnesses, or are preparing for surgery. What about common pitfalls? First, don't assume symptoms mean cancer. Prostate cancer typically causes few urinary symptoms early on and is assessed with PSA testing and clinical evaluation. Second, don't chase antibiotics reflexively. Taking antibiotics without evidence of infection can lead to resistance and reduce future treatment options. Third, don't ignore the role of the nervous system and the mind. Chronic pain often involves central sensitization, and addressing stress, sleep, and mental health is not optional. It's part of effective care. Let me tell you what happened to Don Roberto. After our initial visit, we did urine testing and cultures, which did not show bacteria. That shifted our plan. We started with conservative measures: regular sitz baths, a referral to a pelvic floor physiotherapist who taught him relaxation techniques and targeted stretches, hydration adjustments, and a temporary reduction in coffee and alcohol. We discussed starting saw palmetto and nettle root as adjuncts if he wanted, with the understanding they're supportive and not guaranteed cures. He kept a symptom diary. Over the next 2 months, he noticed fewer nightly awakenings and a reduction in that constant ache. With continued physiotherapy and lifestyle changes, he improved significantly. We agreed to watch his symptoms and only consider medications if conservative care didn't control them or if new signs suggested infection or obstruction. Don Roberto's case shows something important. With the right evaluation and a tailored plan, many men find relief without immediately jumping to long-term medications. But that plan started with proper testing and a doctor's guidance, not with stopping meds or self-prescribing supplements. When should you go to the emergency room? I'll say it again plainly. If you have fever, severe pain, or cannot urinate, seek emergency care. Those signs suggest a serious infection or retention that can lead to complications. If you experience sudden worsening, fever above 101 degrees Fahrenheit or 38.3 degrees Celsius, vomiting, or signs of systemic illness, don't wait. If you're making an immediate plan right now, here's a compact do this now checklist to follow while you arrange an appointment. Hydrate and avoid concentrated urine. Take warm sitz baths for 15 to 20 minutes several times a day. Reduce alcohol, caffeine, and spicy foods. Stand up and move every 30 to 45 minutes if you sit a lot. Try a heating pad for peritoneal discomfort. Consider short-term OTC NSAIDs if safe for you and after checking with your clinician. Start a symptom diary to track triggers and improvements, and contact your primary care doctor or a urologist for testing, rather than reaching for another course of antibiotics on your own. 2 foods that actually help and 1 common food that makes symptoms worse. Cooked tomato products for lycopene and fatty fish for omega-3s can be helpful. Highly acidic or spicy foods and excessive caffeine may worsen urgency and pain. Finally, a few practical notes I give patients in everyday practice. If your doctor prescribes antibiotics because cultures show bacteria, take them as directed and complete the course. If your symptoms improve quickly, continue the full course unless advised otherwise. If your symptoms recur after antibiotics, return for reassessment rather than repeating the same medicine without testing. If you consider supplements, tell your doctor about every product you take. Herbal supplements are not always benign and can interfere with other treatments or lab tests. And if your urinary symptoms are affecting sleep, mood, or sexual function, mention these. They're relevant and treatable parts of the overall picture. In closing, the title of this video was designed to get your attention, but the medical takeaway is balanced and specific. Don't automatically take medication or self-medicate without evaluation. Instead, get properly assessed so you and your doctor can determine whether medication is necessary. If you have fever, severe pain, or cannot urinate, seek emergency care. For many men with non-bacterial inflammation or pelvic floor-related pain, a combination of sitz baths, pelvic floor therapy, lifestyle adjustments, and selected supplements under medical supervision can provide meaningful relief. If you're currently struggling with these symptoms, call a clinician, download our linked checklist, and schedule an evaluation. Don Roberto found improvement through that pathway, measured, patient, and evidence-based. You don't have to accept chronic discomfort as your normal. Reach out for testing, try the safe measures I described, and work with a urologist to build a plan tailored to your results. If this video helped you, share it with someone who needs to hear it, and subscribe for more practical, evidence-based guidance on prostate health. And as always, discuss any changes to medications or new supplements with your doctor before starting them.